I'm Anthony. We're here at the Riverside Neighborhood Health Center.
Welcome to the Riverside Neighborhood Clinic. How can I help you today?
Hey, we're here to find out some information about Teen Clinic.
Oh, great. You're at the right place. This is a public health clinic with Riverside County, and we do have Teen Clinic on Wednesday afternoon from 1 to 4. This is where you would come in and sign in. The receptionist would then give you some paperwork to complete. However, because we do provide services for primary care, meaning that they can come in here if they're sick. We have children coming in for vaccines. We do provide a different room so that you can have confidentiality and then you're not out here with everyone else. So the first step would be to stop here, sign in, get your paperwork, and then I can take you back there to where you can complete your paperwork, and then we also provide education, and you'll have a lot of materials that you can look through while you're waiting to see the doctor.
Well, can I bring a friend with me?
You can bring anybody that needs to be seen. We actually encourage the teenagers to come in, and even if they have any questions, that we can answer for them. A lot of times there's a lot of miscommunication, or maybe they don't understand something. They're afraid to go and talk to their parents about it. So we encourage all of the adolescents and teens to come in and ask any questions. They can also be seen if they want to be seen, and it's usually, if it makes the other person a little bit more comfortable, they can come in together. However, it's really up to the person itself once they go in to see the clinician. It's easier for the clinician to examine one person at a time. But in terms of bringing them in and getting the education and getting all the questions answered, yes, you can bring them with you.
So tell me more about confidentiality.
Great question. What that means is that in the state of California, anyone over the age of 12 can come in for family planning services. So you come here, you're guaranteed to be confidential, meaning that we're not going to call your home, we're not going to call your parents. Your parent doesn't need to be present for us to see you for the family planning services. That's why it's really important that, one, you give us a phone number that we can get in touch with you, so that if we needed to call you for some abnormal test results, that we can call you and you come back for results and for treatment if needed. However, if you don't come back to get treatment, if we can't find you and if we can't get in touch with you, the public health department will go out to your home or to school to try to find you. So then at that point, it wouldn't be confidential because we're trying to find you to come in for treatment. So your parents might find out that way. But if you follow through and you come back to get your results, then everything remains confidential.
Hello, Mrs. Garcia. How did this Teen Clinic come about?
With the high pregnancy rate and the high rate of STD in Riverside County, our 10 clinics, public health clinics, decided to hold a teen clinic on different days. So every clinic has a teen clinic walk-in on different days of the week. Teenagers can come in as young as 12 years old without the parents' consent for family planning services only. And we provide confidential services. They can come here and be assured that we're not going to give information out to anyone, so that they can feel safe. They can give us information and we can provide the services that they're asking for.
I understand that males use Teen Clinic too. What do you provide for them?
Males come here as well. We provide a lot of education for them. We provide education on birth control, on different methods of birth control, because they need to be aware as well as the female as to what methods are available. We also provide education on sexually transmitted diseases and how to prevent them, and what to do, some of the symptoms that they might have that kind of warns them from coming in. We talk about abstinence, and we show them videos, educational videos, so that they can see, kind of gives them an idea, are they ready to be a parent or not. We also talk about We show them how to use a condom, so that way we make sure that they know how to use it properly, because just because you put a condom on doesn't necessarily mean that it's done properly. So we have models to show the teens how to put on a condom correctly. We also talk about the HIV, which is part of the STD, which is a sexually transmitted diseases. Talk about HIV and also ways to prevent it. We also offer you testing as well here, so they come in to get tested and for treatment of STDs as well. This is Marlene Cortez. She is a nurse practitioner, and she does the exams for the boys and the girls here at our clinic.
Hello and welcome.
When someone like me comes in for an exam, what can I expect? What happens?
So you will be brought into the clinic and they take your weight, they check your blood pressure, and then they also collect a urine test so that we can send it off for chlamydia and gonorrhea testing, which are sexually transmitted infections. And then if you need a pregnancy test, they will also do a pregnancy test just to make sure you're not pregnant. And then they get you in the room, they put you in the room, and they prepare you in the room so that I can go in and see you. And what I teach you is how to do a breast exam. I listen to your lungs, to your heart, and I answer any concerns or questions that you maybe have about your health, about sexually transmitted infections, about any birth control method. And we also do talk about abstinence and waiting to have sex until you're ready. And if you choose to have sex, then we make sure that you get all the information you need about sexually transmitted infections and about protecting yourself against sexually transmitted infections. We do not do a pap smear or pelvic exam unless you're having any kind of infection or discharge that you may be concerned about, but we don't do pap smears until you're 21.
Besides abstinence, what other types of birth control methods are available to teen girls?
There are several methods that are available, but abstinence is the number one thing that we do try to talk about, and we encourage you to wait until you're ready to be sexually active. You will receive a pamphlet that includes all the methods, and then we also go through the methods to show you what's available, like birth control pills and like the Implanon, which is a little capsule that actually goes in your arm. There's an injection that you can use for 3 months. There's the IUD, which usually we want you to be a little older and be able to use that for a little longer term. There's obviously birth control pills, and there's also the Nuva ring, which is a vaginal ring that you could use. But whatever method you choose, we want you to use it successfully, so we'll teach you how to use it, as well as make sure that you're comfortable and it's something that you will continue to use on the long term. So we'd like you to choose a method that you'd be comfortable with and that you would be successful using for a long term.
How would a guy like me and all the other guys in the world protect themselves from STDs?
The most important thing you need to know, you'll get a little pamphlet like this when you come into clinic, but the most important thing you need to know is make sure that you know your partner and know their past history. And then once you do that, then you want to make sure that you use a condom, okay? Because even though girls on birth control method, and it will protect her from getting pregnant, it does not protect from sexually transmitted infections. Chlamydia is the #1 sexually transmitted infection in Riverside County. And even though the pregnancy rate has decreased and gone down, chlamydia is still the #1 sexually transmitted infection. And even though chlamydia can be treated, there are other sexually transmitted infections that you can have for the rest of your life, and you can pass on to someone later in your life or someone you end up marrying. So when you come into clinic, you'll be tested for chlamydia, gonorrhea, and HIV and syphilis. And then in about 2 weeks, you'll come back and get your results. And if anything is positive but you don't come back, then the public health department will come and either call you or they'll come and find you so that you can have the sexually transmitted infection treated. All the treatments that are given here, all the testing are completely free for Teen Clinic.
Is there any charge to be seen at teen clinic?
There's no charge to come into Teen Clinic. It's completely free to be seen, to have any birth control method that you choose, and to have testing done or a pregnancy test done is completely free to you.
I heard guys get cancer. How do I prevent that?
Or if you're talking about testicular cancer, guys can be at risk for testicular cancer, especially guys between 15 and 35. They can have testicular cancer. That's something we check for here in the clinic, and we teach you how to do a testicular exam.